Hello everyone, Theopista Nantongo here, the nursing manager at Case Hospital, and welcome to episode 3 of our Reproductive Health Club Series. In this episode, we are having a focus group discussion on what to expect during and after delivery for a normal delivery and a cesarean section. Please remember to subscribe to our YouTube channel, which is at Case Hospital UG, for more videos of this nature. Enjoy the video.
Yes, my name is Dr. Frank Kyeyune, a gynecologist with Case Hospital. Welcome to our antenatal session today, and I'm going to tell you about labor. Labor is a process where a mother gets contractions, and when contractions start, you expect the cervix to open, and that's the mouth of the womb, until to the birth of the child. And one thing I have to tell you that this is the most stressful period for any mother who is pregnant, but having a birth companion and the support from the birth attendants, the health workers, a mother can go through this process joyfully until the birth of the child. How do you know that you are in labor? One, you can start having what we call contractions. These contractions are painful depending on the threshold of pain of the mother. You get contractions as the mouth of the womb, the cervix opens until the birth of the child. When we are monitoring a mother, there are stages of labor. The first stage, the second stage. The first stage has where mother is both in latent and active phase. The active phase begins from 4 centimeters up to 10 centimeters. Normally mothers ask me how many centimeters am I? And normally from 4 to 10, that is active labor, and you mount a mother up to 10 centimeters and until when she has the urge. And normally mothers, they tell you that I want to push. That's when you know that when you examine her and she's in second stage of labor, then we allow her to push the baby out when she's in second stage of labor. Then we conduct the third stage. The third stage of labor, that's when we deliver the placenta, because if that placenta remains there, it's normally not a good thing on the side of the mother. We deliver that placenta, and that's the third stage of labor, so that we control bleeding, because we know bleeding is one of the most dangerous things which can happen to someone who has given birth. And during third stage, we give some drugs also to harden the uterus, so that the uterus can harden and contract well, so that there's no bleeding during and after delivery of the placenta. And normally when we are monitoring you, sometimes labor can fail, and when labor fails, depending on the circumstances, it can get obstructed. That's when the baby is failing to come out through the passage. Then a decision can be made, or the baby can get tired. The mother can start bleeding, what we call antepartum hemorrhage. Then a decision can be made to deliver by C-section. Then we explain the procedure to the mother. Normally we want to tell you that we want you to consent for this procedure. Then we take off some blood to the lab to prepare some blood in case you need it. Then we prepare you for theater. When we prepare you for theater, we put an IV line, we put in a catheter. These are most stressful things because some mothers don't know, but we normally want to inform you during these antenatal sessions that you may have this catheter to drain out the urine, so that when we take you for C-section, urine can come out. You may not be able to control it, but urine comes out through that catheter to the urinary bladder. The process of the anesthesia in the theater depends on how the person giving you the anesthesia determines, but we normally do half, which is the spine anesthesia or general anesthesia, depending on the condition you are in. But you'll find that majority of our mothers will give half, which is the spine anesthesia.
My question is, after I have been discharged and I am at home, what are those things that I am meant to do and those that I am not meant to do as a mother?
Thank you so much for the question. As I told you, labor, childbirth is stressful, but through birth companion and the support from the health workers, you will find that everything goes on well. What should you do when you go back home and what you shouldn't? Actually, after childbirth, we expect if a mother delivered normally, you can do anything because we want you to be as active as possible to reduce on some of the complications which even after delivery can come. After C-section, we expect the mother also to be active but not doing a lot of strenuous work, which can lead you to have pain on the operation site. But if you give birth normally, you can do as much as possible at home without any restriction. Yes, for a Syrian mother, we tell her to be a little bit more, not more active, but not doing a lot of strenuous work, which can lead to pain along the incision site and a little bit of stress. You'll find that when you give birth, the baby is giving you more work. So most of the attention we expect you to be putting on the baby, and you may need someone to help you with homework and other work issues.
My question is simple. You've been talking about the C-section. My question is, when do I resume sex after the C-section?
That's actually one of the most questions mothers ask after childbirth. When should I resume sex after after childbirth? Yes, people heal differently, and you'll find that if you're a person who is faster, there's no problem. You can have it. There's no specified time, whether a month or 2 months or 3 months, that someone should wait to resume sex after childbirth. You'll find that people heal differently. So depending on the healing capacity of a particular mother, and if you feel you're okay and you want it, it's okay, it's fine, you can have it with your partner. But there are things which also will guide you. If you have delivered normally if you had an episiotomy is where we do a small cut around the opening of the birth canal to allow the baby come out, and you'll find that if that place is healed very well, you don't have any blood discharge, and you feel you want it, there's no problem, you can have it. But there's no specific time for that, because you'll find that each mother heals differently.
My question is, I have like 2 questions. My number 1 question, is there any way I can reduce labor pains without using painkillers?
Yes, when labor starts, you expect a few things to happen. One will be pains, which we normally call contractions. You may find that you have a blood discharge, which we call the show, and back pain. Normally, when a mother goes into labor, the process is lengthy. Some mothers even take 24 hours to the time of childbirth. So there are certain things a mother can do to reduce on the pain threshold. One of them, having a birth companion who is talking to you will help you reduce the pain, because that person will be distracting you. Is one way. That's why we allow birth companions. Then 2, if you have someone to rub your back when there's a contraction, you find that actually that one relieves pain, not necessarily using drugs all the time. Then gone are the days where we used to restrict mothers in one position. When you allow a mother move around where she's laboring from, that moving actually helps to reduce pains during childbirth. That's why we encourage mothers to move around. That moving distracts them so that they don't feel a lot of pain during childbirth. Then also, if you feel that the pain is too much, you can always talk to the health workers, to the birth attendants. They will always help you with painkiller. But in most cases, actually, majority of mothers go through labor without necessarily using drugs. And just a birth companion talking to you, rubbing of the back, all this can help reduce the pain, and moving around it when in your labor room, yes, can help reduce the pain.
When do I expect another baby after the C-section?
We normally recommend 2 years so that physically you can be and psychologically to be able to go through another process of pregnancy, and also to this child who is growing up to be independent and cannot be able to disturb you when you are pregnant again.
Yeah, after C-section, does my diet remain the usual, or?
Of course, you have to have a balanced diet. That is very important because the baby is breastfeeding and it gets these nutrients from the breast milk. But what is important, gone are the days where we used to restrict mothers who have had a C-section from particular foods. Actually, after childbirth and even after C-section, a mother can eat whatever she wants. You just eat, so long as this food can help you, 1, to be physically okay, 2, to ensure that there's enough milk production for the baby. And we expect the food to be balanced, to have enough proteins, enough carbohydrates, and enough fats. We don't restrict mothers from these because, 1, they help you gain your physical non-pregnancy state, and also to ensure that there is enough breast milk for the growing baby. So you can eat anything you want. Yes, thank you so much.
When do I know that I am in danger after a C-section or after a cesarean section? Thank you.
A complication can arise after the result of birth of the child. The mother can bleed even after discharge, and the bleeding is one of the most dangerous things in childbirth. So if you see that the bleeding is heavy and a lot, you have to get back to the hospital and you are seen immediately. Yes, you can develop headache after childbirth. Normally, if you get a headache, also we want you to come back to the hospital because the headache can be a two-way. It can be a result of the pressure going up, or it can be as a result of what we call postspinal headache. But any mother who has given birth she can get any complication after childbirth. So we expect you to, 1, if you develop, there are some which are minor and there are some which are serious. But we expect a mother who has given birth that if you develop any of these, to come back to the hospital and you are seen. If you get a fever, come back to the hospital after C-section. If you are bleeding heavily, if you see that you are having a severe headache and pain around the incisional site, you come back to the hospital and you are seen. If you see that you may be seeing that your body is swelling, also swelling may not be a good sign on your side, you come back to the hospital and we see you. But any complication which even a mother who has given birth normally, even someone who has got a C-section can get it. Even sometimes mothers get discharge on the wound. If you see that you have any discharge along the wound, you come back to the hospital and you are seen so that you can be given treatment. Thank you so much for coming for our antenatal session today, and feel free to contact us for any more questions, and we shall continue having more antenatal sessions on different topics, and we look forward to be with you until childbirth. Thank you so much.